Hi everyone, my name is Christine Leach, and this is my video presentation for the Breastfeeding Theory course at BCIT. My presentation is about how to resolve the breastfeeding challenge of a mother with mastitis feeding her baby who has Down syndrome. To work through this challenge, I will be using this situated clinical decision-making tool. The situated clinical decision-making framework could be applied to any healthcare challenge seen by a healthcare professional, but in this case I'm going to use the framework to try and resolve the breastfeeding challenge of a mother who has mastitis who's trying to breastfeed her Down syndrome baby. As you saw, the decision-making framework involves knowledge, cues, judgment, decisions, and evaluation. Here's another look at that model. So using the decision-making framework in relation to our breastfeeding challenge, we start with the category of knowledge. So what exactly do we know about mastitis? Mastitis is an infection of the breast tissue in women who are lactating. I'll show you a quick picture of what that might look like. Mastitis is the most common within the first 3 months postpartum, but could happen at any time during lactation. The risk factors include using only one breastfeeding position, being overly fatigued or stressed, wearing a tight-fitting bra, having previously had mastitis in the past. The most common causes of mastitis are milk stasis from a blocked milk duct, or broken skin on the nipples allowing bacteria to enter. So the next piece of knowledge that we need is around Down syndrome. So what do we know about Down syndrome? In summary, it is a chromosomal anomaly, also known as trisomy 21, and it is the most common chromosomal abnormality in humans. It is typically associated with physical and developmental delays, mild to moderate intellectual disability, and characteristic facial features, and also for some health issues. Infants with Down syndrome also typically have a large or protruding tongue and poor muscle tone in general, as well as of the cheeks, lips, and tongue, all of which could negatively affect the effectiveness of breastfeeding from positioning and latching difficulties. Here's a quick picture of the protruding tongue. Next, in our decision-making framework, we use cues, and this is in the form of our assessment and observations of mom and babe to help understand their particular situation. When we assess mom, we may see the typical signs and symptoms of mastitis, which include a reddened or inflamed area, usually just on one breast, and not usually the entire breast. Here's a quick couple pictures of that. A mom with mastitis may complain of heat and tenderness in the affected area. Mom also may complain of general flu-like symptoms such as fever, malaise, and headache. Next, when we assess babe, we may observe a protruding tongue, poor muscle tone, or sleepiness. Here's a quick picture of typical poor muscle tone and sleepiness. Next, we would observe the mother-infant dyad as they breastfeed. There, we might see babe having difficulty waking enough to feed or having difficulty getting his tongue down to latch. We might also see mom having difficulty positioning her infant due to poor muscle tone. Worst of all, a mom with mastitis may complain of a continuous pain or burning sensation during the feeding. The next phase in the clinical decision-making framework is judgment. This is where we make a judgment call based on the knowledge and cues we've gathered as to what exactly is happening in this mother-infant breastfeeding dyad. In this particular situation or example, we've determined that the mom has mastitis and is learning to breastfeed her infant who has Down syndrome. The judgment part is also where we determine as a caregiver what are our main priorities for this breastfeeding challenge. Personally, my top priorities as the healthcare provider in this particular scenario are, number one, to get the baby fed. Obviously, the baby needs to eat. Number two would be to move the milk. I want to prevent further milk stasis and future problems with milk supply. And number three, as a priority, would be to treat the breast infection, the mastitis, and also mom's discomfort if she has any. During the judgment phase is also where we decide if the consultation of another healthcare professional is needed. In this particular example, the mother needs to consult her doctor or midwife for the treatment of her mastitis. Also, knowing that this infant has Down syndrome and may be very sleepy and have difficulties latching possibly for months, I would refer this mom to a lactation consultant and or a breastfeeding clinic, whatever's close. Also, since this baby has Down syndrome, public health should be consulted for frequent home checkups of the baby's weight and growth. We're now at the part in the decision-making framework where we need to make decisions. That is, decisions around what kind of treatment and nursing support we're going to offer to mom and babe in an effort to take care of the priorities that we set in the judgment phase. Let's take a look again at the priorities. In order to get this baby fed, we'll have to help mom wake the baby if he is sleepy, and then offer some help with latch and positioning if the baby has poor muscle tone and if he has a protruding tongue. The Canadian Down Syndrome Society suggests applying gentle, steady support to the base of the baby's head to help the baby suck well without tiring out. They also suggest the cross cradle and football holds as the most supportive. They also introduced me to a hold called the dancer hand position, which is particularly supportive for babies with low muscle tone of their lips, cheeks, and tongue. I'll show you a quick picture of that. To do the dancer hand position, mom would start with her regular C hold of her breast, and then slide her hand down, around, and forward until her index finger and thumb make this U shape and are free to hold babe's cheeks on either side. This position keeps the weight of the breast off of baby's chin and helps him hold his head steady while nursing. Next on our list of priorities is that we have to help mom move her milk. So after she's fed her baby, mom should hand express or pump unless she feels that babe has drained both of her breasts completely. This will ensure that there's no more milk stasis, which could have been her problem to start with, and this will also keep her milk supply up. We will also remind mom that if she so wishes, she can feed off of the affected side because that milk is safe for baby to drink. For our last priority, we need to help treat the mastitis and keep mom comfortable. At this point, mom should have a prescription for antibiotics that she has started taking already. We can also encourage her to take an analgesic such as Tylenol to control her pain and fever. We can also suggest that she apply cold or warm compresses to the affected side between feeds if it feels good for her. We will also suggest that she try and rest and drink plenty of fluids. Also, we may want to help mom determine what caused her mastitis, so we can help her prevent from getting it again in the future. The last step in the situated clinical decision-making framework is evaluation. This is where we as healthcare professionals evaluate the support and care that we gave. This is where we evaluate if we met our priorities. And in this case, did the baby get fed? Did mom move her milk? And is mom's infection and discomfort being looked after? From there, we can evaluate whether more or different intervention is needed. And since mom is the main caregiver of herself and the baby, this is also the time where we evaluate if mom has all the information she needs, and also if she has all the support she needs to continue to breastfeed. It is also important that we evaluate and even ask mom if she feels confident that she can continue to breastfeed her baby. So that concludes my presentation on the breastfeeding challenges of a mom feeding her baby with Down syndrome while she has mastitis. We worked through these challenges by using the situated clinical decision-making framework to guide our care. We learned that infants with Down syndrome often are sleepy, have poor muscle tone, and a protruding tongue, which all can affect the effectiveness of breastfeeding. We also learned that mastitis is a breast tissue infection, which can be quite painful for mom. To get past these breastfeeding challenges, we learned that mom needs antibiotic treatment along with pain and fever control for her mastitis. Mom also needs a lot of support for positioning and latching her baby with Down syndrome. Well guys, that's it. That concludes my presentation. Thank you so much for watching.